Welcome back to Studio 10. Millions of women and men suffer from varicose veins. Well, you can wear long pants and cover them up, but that won't really help the real problem, which can potentially be deadly. Here to tell us more are Dr. Daniel Mountcastle from Mountcastle Vein Centers and one very, very happy patient, Ms. Dorothy Sims. How y'all doing?
Fine,
Fine, thank you.
Okay, Dorothy, so tell us a little bit about what your experience was at Dr. Mountcastle's office.
Well, I'm very satisfied with it. I just go around shouting and praying all the time, telling everybody, go to Dr. Mountcastle. I've had leg cramps and foot cramps for over 10 years. I've been to every doctor in the world, and nobody could help me. It's always pills, pills, pills. And I saw his ad in the Gulfport Gabber, and I said, well, this is where I'm going to go. It's my last resort. And so I went to him, and praise the Lord, I have been without pain for 2 months. He did the laser treatments. There's no pain to it. You just walk out of there. You walk in, you say hi. Everybody's real friendly. The staff is great, and he is a wonderful doctor. And I just am so thankful that I went to him, because now, for the first time in 10 years, I am free of pain. I can walk 3 miles to the store.
No.
Fast.
Do you do that?
Yes. Yes.
Now, Dr. Mountcastle, Dorothy was, I would say, from what we've talked about on this show, maybe an extreme case coming in already having pain. A lot of your patients come in just with the thinking it's an aesthetic problem, but dealing with the pain already. I mean, how do you go about treating somebody like Dorothy?
Well, we study the leg with an ultrasound, and it tells us very clearly what's going on with the superficial systems that drain the surface of the leg. And then we can say very definitely what needs to be done to fix them. A lot of our time is spent educating. Most patients think that vein work involves just spider veins and varicose veins. They don't realize that pain and aching are a big symptom and a condition we can treat. They don't realize that varieties of restlessness, swollen ankles, skin changes, including ulcers, and cramps, leg cramps, night cramps, are a terrible problem for many people. And their own doctors don't realize that failure of valves in the veins often causes this. When the valves have failed, the whole system below is under pressure. Blood pools down below. The valves are no longer holding up the column of blood, and fluid leaks out all day. At night, your brain says move, but it doesn't say just right leg or left leg, or extensors or flexors. It says both. Well, you can't go in both directions at the same time. So people get these horrible Charlie horses. Their toes curl up. And
right. Well, and Dorothy, I'm sure you were having people tell you all the time all this stuff about, well, you need to eat more bananas, or you don't drink enough water. I'm sure you heard that all the time.
I've done all that. But it's just every morning between 6 and 7 o'clock, faithfully, they just love to grab me, those cramps, and I scream, I holler, I fall out of the bed because I can't handle it. And you can walk it off, but your legs are sore the rest of the day. And you just have to go to him and get it fixed, because nobody should have to live like this. It's just too much pain.
And how long have you been pain-free now?
2 months.
2 months.
2 months, not a day.
And 2 months ago is when you went to see Dr. Mountcastle.
No, it took me a month to get all my treatments.
Right, because you have to do more than one most of the time, right?
Yes, ma'am.
Yeah, it's about 30 minutes in the office each treatment, and we start an IV in the vein that's causing the problem, and close it from the inside with the heat of the laser. Put a Band-Aid on it and send the patient home. There's no more vein stripping, use of scalpels or saline or all that kind of thing.
Now, we want to show you some pictures, too, because this can first show itself as an aesthetic problem. And so we're going to take a look here now at some varicose veins specifically that you treated, Dr. Mountcastle. And the difference from before to after is just amazing on all of these photos. And again, this is just a simple walk-in, walk-out treatment.
They're office treatments, 30 minutes. They don't hurt. They're very safe, very effective. They don't lay you up at all. They're elegant procedures. To be elegant in medicine, it has to fit those 4 criteria. And a patient said the other day it also has to fit a 5th one, should be paid for by insurances, so they do. And that reassures a lot of people.
Oh, that is a good point to make then. So in most cases, this is going to be a procedure covered by your insurance then?
Yes, yes. Now these people had both the deep laser treatment and the microphlebectomy. We numb the skin and make a needle hole about every ½ inch over the vein and remove it through the needle hole. The needle hole disappears and the vein is gone, and people are delighted. This lady was pretty amazed at how much better her leg got.
Oh, I mean, right
about
there.
3 months later.
That's incredible. And if you are having problems not just with varicose veins, but maybe you're having leg cramps like Dorothy, don't just trust the eat more bananas. Don't just drink more water. Go and see somebody, because this could be an exhibition of a bigger problem. So call for a consultation right now. Mountcastle Vein Centers are open Monday through Friday, and there are offices in Isla del Sol, in Largo, in Clearwater, and Sun City Center. There are the phone numbers for you, and you can go to mountcastleVeinCenters.com to learn more. And of course, we have all of this information for you at studio10.tv as well. Dr. Mountcastle, thank you as always.
Thank you, Holly.
And Dorothy, congratulations on being pain-free.
I'm very happy.
Well, thanks for being here.
Thank you.